Have you had runner's knee that has lasted for ages and ages and ages and has not shown any signs of getting better? Today, I'm going to talk to you about the 3 main reasons why we see people with runner's knee not get better. My name is Ed. I run a physio clinic in Southwest London, specializing in treating running injuries. Let's get started. You've had a niggle in your knee for more than a few weeks, and every time you try and run, it hurts. And maybe you try and get back into some running and you're kind of successful, and then the knee pain comes back. Or maybe the knee is so bad that you actually can't run at all. So you've had to pull out some races, you've had to stop going to the running club that you like going to. It's not showing any signs of improving. The first reason why that might be is because using rest is sometimes not the best strategy. Let's start with explaining what runner's knee is. If the maximum amount your patellofemoral joint can tolerate is here, the amount of running that you've been doing has been higher than that. That's when an injury will occur, or when tissues become sensitized, angry, irritated. What that's going to lead to is sensitivity, pain, discomfort. As it gets more angry, maybe swelling, joint stiffness, pain, and sometimes tissue damage. It's obviously going to mean that you have to reduce your running or stop. Now, resting completely from running means that the amount the knee can tolerate goes down and down and down. So even though the pain reduces, the amount the knee can tolerate reduces by quite a lot as well. So that's often why people choose to rest, to try and heal to something like runner's knee, and then they go back to running. It doesn't really work very well, because what the knee needs to do when you run is tolerate quite a lot of force and stress. Resting doesn't expose the knee to that amount of stress. So it means that even though the pain is reducing and the tissues are healing and desensitizing, it's not going to be helpful for when someone wants to go back to running. So that's the first common mistake that people make. The second most common mistake that people make, the reason why your knee isn't getting better, is often due to a lack of consistency. If you're on this YouTube channel, you know that rehabilitation, strengthening exercises, loading exercises, and all sort of different types of rehabilitation movements are beneficial for when we've got an injury. But the challenge is being consistent, keeping yourself accountable, being conscientious, because sometimes the rehab that we do with most of our patients takes 3 months. So that's 12 weeks of at least 3 times a week doing rehabilitation and kind of putting a lot of time into that as well. So if you haven't got a physio there keeping you accountable when it's feeling better, when you've got bored, when you've had a busy week, then only really, really highly conscientious people can keep themselves motivated without anyone else there. What we see is people doing all the right things for a week or two with their motivation at its highest. It may even start to feel better and think, great, I'm kind of feeling better. And then it goes down the priority list and they stop doing their exercises. Other things come up, even without them even knowing they're doing significantly less than they need to. So the changes and the benefits of rehabilitation reduce and they stop getting better, basically. So when they go back out to run, the pain comes back because they haven't put the work in, basically. That's the big mistake and big reason why people don't get better as well. That's another reason why physio is generally helpful and why you can do it virtually as well. You don't need to be physically in the room with someone to keep our patients accountable, basically. The third reason why something like runner's knee wouldn't get better, because of the decision to return to run. Now, in the clinic, we use certain tests to give someone the green light to say we're as safe and as confident as we can possibly be that you're safe and ready to go back to running. Even then, there's also a bit of a kind of science to how much running they will be exposed to based on what we find and what we think is appropriate. There's kind of 2 sides to it. The decision to say you're ready to go back to running, how much running you should do when you start running again. I would say the second one is probably the one that people get wrong the most. They go back to do a 5K and see how it feels and go slow, not realizing that 5K is actually a huge amount of load, especially if you haven't ran for a period of weeks or months. And often what happens is they might get through that first run and maybe feel okay, kind of just see that as a green light to say, I'm back, I'm ready, go back to my normal training, I'll do my interval training again, get on track, full sense of security, either that week or later, the next week or the week after, run into a huge issue where the knee flares up again because it's not been properly exposed, and that kind of gradual return to running that we need hasn't been done, basically. The decision to return to running, we might do things like jogging on the spot for a minute if that's comfortable, where we might do some hopping. Sometimes that's not appropriate, but if we want to be really, really sure, we might do some hopping to make sure the knee's tolerating that. We want to make sure there's no swelling. We want to make sure the knee range of motion is good. We might start off with just a minute on, minute off on the treadmill, make sure that's okay, do maybe 3 repetitions of that. We also want day-to-day activities to be pain-free, things like stairs and things like that. Some of the things that we would want to test to make sure we're happy for that green light to go up, to say, let's try some running. In the return to running part, it's going to be things similar to, let's call it like the couch to 5K. If we want to be really conservative, if someone's a much more experienced runner, maybe they have a race, there's different strategies. We might try like a 5-minute continuous, really, really slow run. then we might do a 10 or 15 or 30-minute one, and we might run for as long as we continuously can before or up until the point where we feel sensitivity. That then gives us a baseline. There's different decisions that we make based on the individual, because if there's no pressure and the patient's happy to take their time, then we probably will just take a really slow and gradual approach. But if someone's really experienced, has a race, has a goal, that's where we might, be a bit more aggressive with the return to running program as well. So that's often the mistake that people make as well, going into their return to running way too fast. So there's some of the reasons that we see, the top three that came to mind. There's obviously lots of other reasons as well. If you have any questions, leave them in the comments below, and I'd love to help. Thanks for watching.